Thank you all and welcome again for joining us for our eighth episode of Coffee with a Side of Healing. I'm really grateful to have you all again joining us here on this platform to observe some of our resources. Today we have a very awesome show with some great resources to share with you. We're going to have V.P.A.N, who's going to be talking to us about their program. We're also going to have a little bit more information in relation to what that program is, veteran support, things of that nature. Once again, my name is Jaime Gomez. I am with Service Area 7 Administration. I'm one of the community health workers with the administration team. And I'm very grateful to be here on what is this, our eighth episode, Erica?
Yes.
Awesome.
Ocho.
So with that said, I want to go ahead and do what we typically do. We're going to do a little bit of popcorn. I'm going to mention someone's name so that they can introduce themselves, give a little bit of background, and then they can popcorn off to somebody else. So I typically like to pick on people that I haven't called on before. So let me see here. Let me spin the wheel. All right. So Anne, why don't you go ahead and introduce yourself and tell us a little bit about yourself, please?
Sure. Thank you, Jaime. My name is Ann Cheever, and I am a clinical social worker, and I work for the Greater Los Angeles Veterans Administration, and I work specifically in the Office of Suicide Prevention, which is a huge program, a national program that the Veterans Health Administration has pulled together over the course of the last number of years to really put an emphasis and focus on helping reduce suicide risk amongst veterans.
And go ahead, Anne. You can select somebody else.
Okay, I will select, since I'm learning some new people here, Vanessa, I'll select you next.
Hi, Anne. So hi, everyone. My name is Vanessa Bustos, and I'm here representing the PRC in Service Area 7. We are a new program that launched about 3 months ago. So I will actually be using your resources at our PRC. So it's actually a great way to meet here and connect. So thank you for coming, and I look forward to getting to know what you offer. So now I will go ahead and popcorn Erika.
Thank you, Vanessa. Thank you, everyone. Great to have everyone here at the podcast. Like you mentioned, Jaime, it's our eighth episode. So my name is Erica Corral, and I am one of the coaches for the Great Salt 7. And I'm looking forward to getting, more of this information out there to the community so it could be like a hand's length. So with that say, I'm going to popcorn Angel.
Thank you, Erica. Thank you. And good afternoon, everyone. I go by Angel. My name is Angel Soriano. I'm a licensed clinical social worker. I'm also a mental health clinical supervisor here at Central Juvenile Hall. I previously worked at V.P.A.N. I just recently promoted here to Central over here in February. So I worked with V.P.A.N. I'm also a military veteran, Marine Corps veteran, and also I'm still in the reserve. So I got about 14 years total as a rank as a gunnery sergeant right now. And so, so I'm very familiar with the V.P.A.N. program, work collaboratively with Anne and her team at the VA with suicide prevention, and excited to be here. Thank you for having me.
No, thank you. And thank you for your service, Angel. That's super cool, super respectful for that. Definitely. But I'm so glad that you could all be here with us today and kind of really share with us about V.P.A.N. And I'd be, if I forgot to say this, the way this was first introduced to me was through one of our coworkers, Brigida. She is our school-based coordinator or O&E coordinator. And she was telling me, I think when most of us got redeployed, she was redeployed to V.P.A.N. So she helped out for a great amount of time, and she kind of shared some information with me. And she's like, they would be great to have on the podcast. So I'm not sure, Angel, if you want to share with us a little bit about V.P.A.N. and feel free to chime in, Ann, or anybody else, but just kind of really educate us. Maybe just starting off by letting us know what is V.P.A.N.
Yeah. Thanks, Jaime. So V.P.A.N is a Veteran Peer Access Network program. It's the the county veteran program for LA County Department of Mental Health. And what we do here at V.P.A.N is primarily referral and linkage services. And primarily, those have been with the county in the past know the veteran program is Valor, which was an FSP program. And so that was primarily a clinical program where we transitioned into a referral and linkage, and where we're getting connected to veterans, helping them find those resources, finding the appropriate level of mental health care. If they're looking to get any type of resources for benefits, get them connected to VA. We try to navigate that process and do that referral and linkage with good referral and linkage services, not just here's a phone call, here's a phone number, call this number. We actually want to make that warm handoff, and then make sure that veteran or that military family member was able to get access to that resource. Another thing that we had going on here at V.P.A.N is the community suicide prevention coordinator role. And basically we're finding veterans who are at high risk and getting them connected to mental health care, follow-up, identifying where they're at in the risk level. And we had a collaborative relationship with the VA. And so that's a little bit about what we do here. I mean, if you have any questions, I can clarify further, but that's what we have here at V.P.A.N.
Great. Thank you. Thank you for sharing that information with me. So a little bit about myself. In a past life, I worked in a call center, and I was really passionate about actually linking individuals to services instead of, just giving the number. I think statistically you learn, or you start to realize that a lot of the times when you give somebody a number, they tend to not really follow through, right? You have to really do that footwork and put them in contact or make that connection for them. So I think that's really cool that you're all doing that.
And I can chime in a little bit to tell you guys a little bit about how the VA and V.P.A.N kind of work synergetically together, and just sort of it might help to get a broad overview of sort of when we talk about identifying those veterans or individuals out in the community, even who are highest risk for suicide. One of the biggest parts of suicide prevention in the VA is just asking people and really triaging and finding those veterans who are at the highest risk for suicidal crisis, suicidal behavior, or adverse events due to those emotions and crises. So for instance, just so you can hear a little bit about like what this might look like in terms of a veteran coming into our system and then maybe getting triaged to V.P.A.N. is, so one of the biggest roles that I do as a suicide prevention coordinator at Greater Los Angeles is our team receives all of the veterans crisis line calls that come in for LA County. Now those calls, there's a national call center that's get linked into at first when they call at 2 o'clock in the morning or 3 o'clock in the morning and they're having a crisis of some sort. And then the next business day, all of those calls get triaged to someone like myself, a mental health professional in the Office of Suicide Prevention at the VA. And then from there, we reconnect with that veteran. And the first thing that we're doing is reassessing their risk for suicide. And then we're really looking at the psychosocial issues that may be contributing to their crises or their risk factors. So for instance, these are things like, housing issues, legal issues, interpersonal relationship issues, interpersonal, intimate partner violence. It can be a cadre of stressors that may have prompted that veteran or individual to call the crisis line. And then from there, if that veteran is not receiving services at the VA, maybe because they are not service connected, or maybe they are just simply choosing not to engage in care at the VA level, that's when I'm sort of looking at a program like V.P.A.N to fulfill that gap. And so it's been a really nice collaborative relationship in which I can then put in a referral for that individual directly to V.P.A.N, and the V.P.A.N team will get back to me and say, hey, we got this referral for John Smith. We're going to reach out to him. And they're very, very good about reaching out. I would say by the time they get that referral to that first outreach call, it's like 24, 48 hours. It's not a long wait. They're not waiting forever for somebody to get back to them with some concrete resources, support, ideas, directions for getting them engaged in care. And so that's just a really nice partnership to have, particularly because we are on the receiving end of these crisis calls on a daily basis. And these crisis calls are increasing just based on what's going on in our world. And as well as we're anticipating the rollout of the new 988 mental health crisis line number. So we're, already anticipating, I think that's rolling out this weekend. We're already anticipating a huge increase in volume of crisis calls, but by proxy of that, that just means that we're going to be able to identify more people and get more people into care, right? So that just gives you just a little bit of an example of how the VA and V.P.A.N kind of work synergistically together.
So I had a question for Angel or for Anne, whoever can answer. But I'm so glad that you guys go like right away, like you said, as far as like 24 or 48 hours. I think it's so crucial, right? Because I think a lot of the time is being able to address it in the moment. How do you all work when it comes to like their natural support, their family? Because obviously you do have the individual, but obviously it also helps to engage within whoever is being identified as a family or a natural support, and if that's something that is taking place, because I think it also helps to engage everyone.
Yeah. So, Anne, did you want to go first?
No, you can take it, Angel.
I'll shoot. Okay. All right. Yeah. Thanks, Erica. I think, yeah. So with that, incorporating family is something definitely that we do on a normal basis, because we know that incorporating family is known as a protective factor for our veterans. And with that being a protective factor, that's a positive. So if the veteran has family, then we'll incorporate them for sure. And many times the family members are supportive of the veteran getting access to services. So communication is key among everyone, among the family member or the veteran. So definitely we do incorporate the family when we have the opportunity. On the other hand, sometimes we come across veterans that don't have any family out here in Los Angeles area, and so that can make it kind of challenging when connecting them to those protective factors to like family. And so it goes hand in hand. So sometimes a veteran will have a strong support system, but then we also have veterans that have very little to no support system at all. And sometimes I've even had clients inform me that I was maybe someone who was the only one who called them at times. So connecting them to supports is key.
Yes. Thank you.
I'll also add too, as part, so whenever a veteran is identified at high acute risk for suicidal crisis, then what we enact is sort of our best practice for providing enhanced care. And part of that is developing a safety plan within 7 days of that initial call or crisis or indication that the person's really, having a harder time. And that safety plan is really a working document between the veteran and their mental health clinician that they can take with them. And a big part of that safety planning is involving family. It's so if a veteran has a wife in the home, we try to have the mental health clinician develop that safety plan with what are some things that your wife can help you to do to help you stay safe in the house. Can she help you manage your medications? Is there a family member who maybe could take your firearms off your hands for a few weeks, just so that out of sight, out of mind, less temptation? So we're really incorporating the family and the support system as part of that safety planning and how they can play a big role in mitigating that suicidal risk for that individual. So that's a huge part of sort of that providing that enhanced care, is making sure that, you know, within 7 days of this person having a crisis where they have considered suicide, that we've developed this plan that involves family, and even giving family, you know, a copy of that plan so that if that person, you know, encounters that level of crisis again, they can turn, you know, their family member can step in and say, hey, you know, that mental health clinician you talked to, and she said you could call these numbers when you're feeling this way. Why don't we give them a call? So so that's just kind of an example of how we you know, incorporate family into that mechanism of risk mitigation.
So I definitely agree with Erica that, you know, involving family, it's extremely important because, you know, what affects our family members affects us, and we're all connected. And just sharing how you were sharing that some veterans don't have family, that is a reality. And in that sense, what can we do as a community, or what is V.P.A.N doing as a community to provide maybe like a peer support group for someone? Just coming from a PRC myself, we're all about connecting people to resources. Is there anything in place, maybe like a peer support group, where they can kind of help each other and kind of become their own family, right? Since they're on their own. And we all know that a big trigger for depression and suicide is feeling alone. So what can we do as a community, or what can V.P.A.N offer to kind of mitigate that feeling of feeling alone and then prevent depression in a sense?
That's an outstanding question, Vanessa. Thanks for sharing that. So I think that's a good question, because V.P.A.N is designed for that, is to capture those veterans that need access to services and that need that peer support again. And so some of the things that V.P.A.N has done is, as we do it, there's a lot of psychoeducation, educational to the community about the veteran resources. The nice thing about V.P.A.N is it's countywide. It's countywide. So there was, I know historically there was some events within the community. For example, we had one at Pasadena City College, and we did a SAVE training, which is a suicide prevention training in collaboration with the VA. So we did a SAVE training for the students and the community members, and then also there was another event where there was vendors there of different nonprofit organizations that provide resources to veterans and family members. And so a lot of that was to get that information out to veterans and family members. And those are going on throughout the county. That's just one example. I mean, I know there was some I mean, not in the Inland Empire, but we had one in San Pedro, in different parts of the county. And so that's one way. And then the backbone, the bedrock of the V.P.A.N program is peer support. Many of the staff within V.P.A.N are actually veterans themselves, and or military family members are connected to military family members. So they have that understanding and that of the veteran culture and able to connect. And so it's a matter of getting the veteran connected to V.P.A.N and finding out their individual needs, their location, and seeing what's going to work best for them, because there is a wealth of resources out here in LA County. That's the beautiful thing about LA County. We do have a wide variety of veteran resources for our veteran population.
That's awesome.
So yeah.
That's really cool. You know, I did have a question for you and Ann, and whichever one can take it first, but it's maybe a two-parter. So I was wondering, if your programs offer like a component of outreach. I know you mentioned FSP earlier. I know with FSP we tend to do outreach to the community, right? Once a referral is made or that linkage is made, the provider will go out to the individual's home. So my question was, number one, if your program had a component of outreach that you do to the community, and secondly, have you ever included like the home team? I know that a lot of veterans struggle with homelessness, and so I was wondering if you had ever gone out and done outreach together, or again. So I'm not sure, Angel or Ann.
Yeah, I'll take this one. And Anne, if you have anything else to add to it, I know it's kind of it's V.P.A.N oriented. Jaime, yes, for sure. Outreach was a part of a weekly routine for us here at V.P.A.N. We did oftentimes go out with the V.P.A.N with the home team and conduct outreach out in different parts of LA County. I know we did a lot of collaborations with the home team and different nonprofit organizations on Skid Row, where we would go out and do outreach on in that area. Me personally, I would go out with US Vets, which is a nonprofit organization out in Inglewood and Long Beach, and we would partner up with them and go into various encampments and educate individuals about the V.P.A.N program, explore if there was any veterans who were unhoused out there, and educate them about the program to see if they needed to get connected. Because a lot of times they can get disconnected from services, and it's just a matter of coming across that a peer, someone who has information on veteran resources and getting them reconnected. So yeah, that was definitely one way that we did do outreach at V.P.A.N.
That's super cool.
And in the VA, since veterans have, they have more specific services that tied into their VA benefits, things like their VASH caseworkers, we work very closely with them. So if a veteran we know is struggling, they're out in the community, maybe they're not making it to their appointments, we might call their VASH case manager and say, hey, we know the guy is housed, but he really hasn't been going to his psychiatry appointments and we're kind of worried, and or maybe we've gotten some crisis calls but we can't make contact with him because he's not picking up the phone the next day. So we utilize our VASH and our peer supports internally to the VA. And then additionally, we're starting to develop our own sort of mental health evaluation team within VA specific. It's sort of in its infancy, but in regards to having, sort of somebody from our VA PD as well as a licensed mental health clinician that can actually go out to, some of these encampments and track down some of our guys that, we're really worried about from a suicide risk perspective, and they're not making their appointments and they're maybe floundering. And there has been some, early successes I've already seen in terms of the development of this team, which is just starting to get off the ground in terms of being able to really kind of, just go out in the community, intervene in a way that's different from, a traditional welfare check, that it's more personal, it's more vet centered. It's much less of a hostile, hey, you're not taking care of yourself, we're going to take you to the emergency room and put you on a hold. It's more, hey, we're concerned about you. Can we get you over to the VA to get some support, some resources today? It's much more collaborative and kind of working, gingerly with these veterans who may have sort of a waxing and waning relationship with the VA services, or with generally getting care for themselves.
Can I add something? Anne, you brought up great points, and it wouldn't be right if I didn't mention this, but in addition to V.P.A.N, additionally to V.P.A.N, we did a collaboration with Home Team. We also did a lot of collaboration with the Sheriff's Met team and LAPD SMART team. So, for example, if the Met team or the SMART team identified a client that was a veteran, they would often contact V.P.A.N, and we would do a joint outreach and meet with those veterans out in the community. And so we would use that culturally competent approach and awareness of the military culture to help build rapport and ultimately assist that veteran get access to service or provide that education on different resources that may be applicable to them. I just want to add that. Thanks for mentioning that, Anne.
Definitely.
No,
And that's
cool.
really, really good. You read my mind, Angel. Sorry, Jaime, but I was just about to ask when it comes to that, being able to address that cultural aspect, right? And being able to meet them where they're at, whether it is that they have encountered, within the sheriff's department or why not, but there is that communication between systems to being able to support, or if the individual does desire to go through the process, that there is that process that everyone speaks, and that person is able to have that trust. Because I think that's why, like I heard it earlier, you guys do respond from 24 to 48 hours, because there is that window, right, when it's kind of like I want to, and then it kind of can close. Very crucial to meet the individual there. I'm so glad to hear too, Jaime and Vanessa, like Anne mentioned, that there is that multidisciplinary team, because then there you have more of that communication and that angle of like, how can we help you? What are some of the barriers versus like, this didn't happen, let's go this way. Because I think a lot of the times we want to like provide that support, provide those resources to support. So I'm happy that whoever is listening can also feel that if they do have that incline, that there is a process, it's already here in place. Angel and Anne have been working on it, but at the same time, you're the key person that needs to start the process, because everyone's already been taken care of. Sorry, Jaime, didn't want to like interrupt.
No, no, it's okay. You know me, I apologize. I tend to get excited and there's no raising hands here. But what I was gonna say was, what got me kind of riled up was I really like the fact that you're incorporating kind of the peer opinion, right? Or we have peers. A lot of times, as we've come to understand that, it makes it easier. You form a connection. There's more of a connection, right? If I'm more open to receiving services if I speak to somebody more like me than although like I definitely agree, and this is just my personal opinion, but I also feel like a peer in a sense is a part of that treatment team. Maybe not clinical, but you do bring as a peer a component that can only be brought by that peer, right? So maybe if you're struggling to engage somebody out in the community, right, that peer might be able to connect with that individual in a different way, and you finally get that opportunity, and it clicks for them, right? Why they should engage in the services. But I think this is really cool. I've already learned so much from both of you, because I'll be very honest, initially when we were getting this going, I was talking to Vanessa and I was like, we're gonna have V.P.A.N on, but don't ask me what they do. I'm really not sure. And I think they do something with veterans. So this is really cool. It's educational for me and more so for our community. I think again, one of the cool key components for us is that I think Erika mentioned this earlier. This podcast was literally developed as a request from our community members. So when the pandemic happened, for all of us who are used to doing outreach, right? It was, how do we reach our community with our resources, you know, in a different way that we've never, at least, within our circle of services, we've never really tried, right? So I can't remember exactly whose brainchild it was, who suggested doing a podcast. And I was hesitant because I was like, yeah, maybe I can do it, but I have to build a website and I don't know. And, all these little things. But now that we started moving forward, it's something really cool that's developed into a very robust way of sharing our resources with our community. And again, kind of letting them know what's already available. But more importantly to me, just kind of wrapping it back into that whole peer component. Um, this came from our community members, from our peers, that they kind of wanted something like this, right? So we were able to build this for them and to be able to share these resources with them. And in my way of thinking, I remember what I said to my boss was, think about it as I said, think about it as reverse outreach and engagement. I said, we're not really going out into the community, putting anybody in danger, but we are providing them these resources. We're making them aware of these programs that sometimes have been in place for years, right? So I think this is really cool what you all have shared about your programs and what you do.
I just wanted to share that I really do see the importance of peer, and I'm really grateful to see that there is a peer aspect. It is extremely important, even within ourselves, right? When you see a restaurant that may not catch your eye, you will go because your peer said it's a good restaurant. So I think it's so important too, even in that community where, they may feel like, I'm about, there's a big stigma with mental health, but then also to have a peer and say, hey man, like I was going through the same thing. I was struggling with the same thoughts. I called V.P.A.N. They hooked me up, they connected me. And I think that that's so strong because not only are they getting a referral from a peer, but then that trust is there. So it's not like
Yeah.
you're going somewhere and not knowing what to expect. You're automatically, your trust is already invested because your peer is letting you know and you trust your peer. So it breaks down that barrier of not wanting to trust the system, right? They're already connecting with you in that sense and saying, hey, I've been there, done it. And for me, suicide prevention is dear to my heart. Unfortunately, my sister lost her best friend at 16 to suicide, and it was like gut wrenching for us and my family. And we were so close to him, and unfortunately, he didn't have resources and he didn't really speak out. So I think it's so important as a community just to be aware and be there. And especially if you know someone that's a veteran that's alone, reach out. We're all human beings. We're all here to love each other, support each other. So I think this is great that you guys are bringing that awareness. And I know that the PRC is trying to do a suicide prevention month for September. So maybe we can collaborate and really bring out those resources because our veterans are a very important aspect of our community that we definitely want to support, especially now that the holidays are coming up too.
Right, right. And I was going to say, I kind of love this idea of the podcast coming out of this kind of, like you said, Jaime, the reverse engineered outreach, right? It's sort of like build some information that people can access at any time versus, it's kind of a scheduled training or educational seminar. It's just, it's available to people. And one thing I always like to let anybody know. I mean, you do not have to be a veteran to know this information, but if you are worried about a veteran, a loved one in your life who is a veteran, you can call as a third party to the Veterans Crisis Line and say, hey, my brother is not doing well. He's, held up in his apartment and hasn't come out in, 5 weeks, and we're really worried about him. And the Veterans Crisis Line will actually outreach to that veteran, and better yet, those calls will then get, kind of triaged back to us at the local level, and somebody like myself will pick it up, run with it, try to contact that veteran, make that referral to V.P.A.N if that's, the most appropriate route to get this person services. So it's just really nice to be able to give people very nuanced information about what to do, because that's the number one thing I hear from family members is a lot of times they know somebody's struggling, but they have no idea what direction to go in, or who can I call? Who can I call?
Right.
What can I do? I don't know. Their doctor won't talk to me, whatever it may be. And so,
Right.
yeah, I just wanted to add that piece. That's just a great piece to have it there living here, sort of in a
And
podcast.
now that you're saying that, what is the number to the hotline?
That's a good question. So on the 16th of July, you will be able to access the Veterans Crisis Line at the 988 number. So it'll just be but for now, you still have the 1-800 number, which I'm going to have to actually look at my,
Sure, no, go ahead. And you know
so,
what? It seems like both of you are very passionate. I don't know if you guys want to share a little bit as to what got you involved and what your passion or how you were connected into going into this field, especially with V.P.A.N.
Sure. Let me, I'm going to give you the Veterans Crisis Line number really quickly,
Sure.
just so, while I have it popped up. So the traditional Veterans Crisis Line number is 800-273-8255. Press option 1. So it's 800-273-8255. I think if a veteran even calls our scheduling line, they get an option to connect with the Veterans Crisis Line. But as of, I believe, July 16th, you will also be able to access the Veterans Crisis Line through that new 988 number, mental health number. But in terms of my interest in suicide prevention, I've been a licensed clinical social worker for 16 years now. I actually started in North Carolina in inpatient psychiatry. Just always had a passion for working with people with severe and persistent mental illness. And over the course of my years in the field, gradually gravitated more towards suicide prevention and working with people that have either recently had a suicidal crisis and trying to get them support, or right now, kind of trying to prevent a suicidal crisis. So, and I'll pass that to Angel. He's probably got his his passion, where his passion came from.
Hey, thanks, and I appreciate that. And thanks for that question. For me, as I mentioned earlier, I'm a Marine Corps veteran. My father was a Marine, my brother was a Marine, and so I think even my kids are going to be Marines. I'm just kidding. Whatever they want, I support. No, so I'm super passionate about it. I did 4 years in the Marine Corps in Kaneohe Bay, Hawaii, and during that time I was in the infantry. Did 2 combat tours to Iraq. And so with that, you see a lot of the challenges that a military person can go through in combat, in the military. I've seen a lot of the substance use, mental health issues. And so once I got out of the Marine Corps, out of active duty, you know, I had this outstanding, amazing benefit of the GI Bill. And I used that, and I used it to my advantage. And I you know, I went to school for psychology, and I got some good advice to get a social work degree and do it right after instead of waiting, because my thought process was like, okay, I'm going to have a degree, I still need experience. And someone said, you know what, just go for the MSW degree and you're going to get that experience. You have that experience from your military time. And so I got it, and you know, just getting that social work education just helped me to see more of what I noticed in my time in the Marine Corps. And then knowing that I now was equipped with this education, and also having that personal experience of being in combat 2 times, and then also bringing that peer approach. I said, there's got to be, I need to use this to my advantage and say, hey, I gotta use my strengths, and use that educational piece, that peer support, and give back, because that's where my passion is. And I've just been given some outstanding, amazing opportunities that I'm super thankful for, and I've done my best to take those opportunities and give back, just with my knowledge and my experiences.
That's really cool, Angel. You know, it's so funny. After time and time we've done this episode, right? And just in conversation with people, a lot of the times what I find in this field is that a lot of the people who do this work is due to intrinsic motivation, right? We all have something within us, a reason that kind of feeds that wanting to help, right? We all have a reason why we kind of got into this field. For me personally, I have always shared this with the group. My friends always say, dude, why don't you just get into the technology field? And I'm like, well, I kind of like helping people. They're like, yeah, but you could be making so much more money. I'm like, yeah, but I kind of like helping people. You know, it's kind of my eccentric motivation to being in this field, right? But I think you have to have that internal passion, right? That even if you identify as a peer or not, we all have a little bit of that internal fuel or passion that motivates us to get up every morning. And this isn't easy work. You know, it's a battle. It's tough. You know, especially if you're dealing with cases, or if you're helping individuals, who are struggling. It's definitely a battle. But I applaud both of you again. It's because I know it's a tough job, working at the VA or working with V.P.A.N, or now for Angel's promotion, right? But it's really cool. I think it's really cool from both of you.
And I think so too, Jaime. I think I'm so glad, like Vanessa had mentioned earlier, the fact that there is that peer component, but at the same time, like once you meet the professional, and they, maybe we go through, like, you have 2 licensed clinical social workers, there is that person, there is that connectivity that you are going to be able to, like, get that human touch, and being able to, like, provide that support that um I know what it is to be where you're at, and this is a process. I really appreciate it to know that there's been a lot of groundwork and working systematically. That if anyone comes to, or doesn't say like I need help, but maybe coming to the attention of the sheriff's department, or coming to the attention, like you said, Angel, how you guys team with like the Inglewood organization, being able to know that if anyone falls through those safety nets, quote unquote, that both of you guys have been there, or in essence, the system to support the individual, and know that this is the path. And this is every day, right? We work Monday through Friday to do this, but at the end of the day, even if today's podcast gets to one person, then I will say that we have
Yeah.
done our job. But at the same time, I would love to have everyone feel comfortable and trust it, but also trust themselves that they could do this path. And they've done such great work, servicing our country, and for us to be here present, right?
Mhm.
So that now the least we could do is being able to provide all that linkage, all that support. I've always said knowledge is power. So if we
Yes.
don't know this, then we wouldn't know how to access. And it's like anything, right? We first learn how to walk by holding on to other people. Sometimes we crawl, sometimes we fall, but eventually we learn how to walk. So I'm really thankful. I did not know much about the veteran program, but now I do. And I'm hoping everyone who's listening also kind of like maybe feels that way as well, and knows that it's only a phone call away, or that you could reach out to someone like Angel and Ann that can support you through the process, and you're not alone. There's a whole system to support you. So I'm very, very thankful. I've learned a lot today for myself.
Yeah, and I have to piggyback on Erica. It's knowledge is power, and we were just having that conversation, right? Sometimes our community um, needs certain resources, but because they don't know about them, they can't tap into them. And I think that's why this podcast is so important. So I really can commend Jaime and Erika for taking on the role. I'm just here as a visitor today, but it's super important. It's super important. It's so easy to just get up and share, right? Just copy and paste the link and share it. And you never know when you're going to need a resource. And I think that that's why, even if it may not be for somebody today, it may be for somebody tomorrow. So I think it's super important. And I appreciate both of you guys' passion, because I think passion has a lot to do with it when you're building those client rapports, right? I don't want someone that I'm going to go to and talk to in my time of need that's not going to be focused, that's not going to be passionate, that's, are just in it for a paycheck. And I think as peers, we're easily able to see through those walls, right? We want to feel heard, and especially someone that's going through suicide wants to be heard. That's why they are where they're at, because they feel alone, because they feel depressed, because they feel unheard. So I think it's super important, and I really appreciate your passion. So thank you for coming.
Yeah, this is Angel. So I want to go ahead and just share a couple things about V.P.A.N that I didn't mention earlier. So V.P.A.N, it's a countywide program. It's a regardless of discharge. You don't have to have an honorable discharge or to come to V.P.A.N. So if you're a veteran, you serve 1 day in the military, you're a veteran in the eyes of this program. The other thing is, it's not just for veterans. If you're a military veteran family member that can use some support services, have some questions about getting connected to VA benefits, give our program a call, and we can support with that navigation. And so we are countywide. It's veterans of all different eras. You don't have to have a certain service connection, disability rating. Veterans know what I'm talking about. You don't have to have any type of rating to come to the program. And if you are interested, or if you know someone interested, please reach out. The second thing I do want to add is V.P.A.N also has a support line. It's a support line. It's an emotional support line. So if a veteran or military family member is maybe just needs a chat with someone, or process something, we have a support line here at LA County DMH V.P.A.N, which is 1-800-854-7771, and you're going to press option 3, which you'll hear in the recording, which is for military veteran option. And then it'll be live connected to someone that will be able to provide that additional support. Or if they want to get connected to submit a referral, they can also call that hotline. Or another way to get a referral is to go to the DMH website, to the veterans category. And then from there, you can submit a referral within the website. So those are the 2 ways to get connected. But those are the 2 things I want to mention. Thanks, and back to you.
Angel, that's actually really awesome. I love the fact that that they do still honor those that were dishonorably discharged, because as we know, that could have entailed because of their mental health, right? So I think that's super important, because a lot of veterans that have that dishonorable discharge feel like they're not able to get any services, and we don't know the circumstances or what they were going through mentally. So I think that's super important, and especially that they're extending it to that family is extremely important, because as a wife, whatever my husband's going through, I'm living through, right? If they're dealing through PTSD and depression, that's not only affecting him, that's affecting me and our household if there's kids in the house. So I think that's super important, because when someone's in recovery, it is like a family unit thing, and it does take the family, right? Takes the village to really work together. So I think that's great that V.P.A.N's doing that. That's awesome. I didn't know that aspect of it. So thank you for sharing that. I just want to say, honestly, this was awesome, and I think that this is definitely a great resource that we need to promote a little bit more. And I think that's where outreach, right, and engagement really has to kick in. And I know with the pandemic, things have definitely slowed down, but we do need to get more creative on providing resources to those that really need it, especially with the pandemic, with depression and suicide rates going up the roof. I think that the podcast is a great way, and I think just as us, just really connecting with each other, networking with each other, and just providing those resources to those around us is definitely a great way to get going. But yeah, thank you. This is an awesome program. So hopefully we can really start promoting it within ourselves and in our own networks too.
Yeah, definitely. It's funny you mentioned that I need to get on like actually advertising it and like moving it forward in that direction. But I agree. I think my concept behind it was just putting a spotlight on those resources that us as professionals we know are there, right? Again, I think I mentioned a little earlier that I worked at a call center for a very long time, and so I got super familiar with all my resources, but the community still doesn't know, or they don't know
Yes.
necessarily how to access them. So, that was kind of the idea, as I mentioned earlier. You know, I've sat through many presentations, as I'm sure you all have, but I don't think that gets to our community the way an actual conversation would amongst people, right? Because before we're professionals or peers, we're people, we're humans. And I think connecting as humans through this platform and putting that face or that spin on what we do actually, I think goes a long way. But
And
definitely, thank you, Vanessa. Go ahead.
and I think adding to it too, like Vanessa said, being able to like have it to be interjected to the community. So I'm really hoping that if everyone, did not know about these resources or had a misconception, like now, this is the way it is. Because maybe a lot of the time, maybe the neighbor or the comadre might have been like, no, this is the way it is. And like, no, like they just went over all the details. This is what it could be offered. I think everyone has a different, experience. And I am so glad that it's literally like, Angel mentioned, a phone call away or being able to access. And it's very open to everyone, because you do need to have that support from the family. You do need to have that support from, everyone. But obviously, like I said before, it starts with the individual. And I'm so glad that it's being supportive, and I'm hoping that even as we speak right now, we're also kind of engaging among ourselves to continue to have that network, because within our different systems, we're going to come across for that need for that referral that can help. And I've said it myself too, like every time I do a referral, it's not just so much like go over here, but this is the person that you can speak with, because it makes it more personable, and the referral most likely will go through. So I'm very thankful for the resources once again that you all provide. Very thankful that there is that passionate individual behind that licensed clinical social worker, that
Yes.
we do get up every day to do this. So I'm really hoping that everyone who have the need or know someone, or like you said, Vanessa, they can have that information just in case they do come across someone and be like, oh, when I watched that podcast, there was some
Yes.
information there, or they could just click it, right? I think a lot of the time before, it was more of like, well, here's a flyer, or you could go here and do this. And like now you could just send a link, or you could do a screenshot.
Yes.
And for everyone that, I would say my mom, she still has a flip phone, then you could still like watch it with someone, and like see it there. But I think we are definitely going to that digital era, and being able to have accessibility, and being comfortable to speak with someone that knows where you've been and really understands that, because they could see through us, like when we say like we
Mhm.
understand, and you could be
Yes.
genuine and be like we don't, but we're still here with you, you know. So very much thankful for all the information you both provided, and I'm looking forward to continuing to provide this information to everyone that we come across. There's what, five of us in the room, so we each and one of us at least tell someone, say like five
Yes.
people. We already told 25 people, so I'm
Yes.
hoping we can continue to do that. Thank you very much.
Thank you. And thank you all again for joining us. I guess at this point we're gonna go ahead and sign off. So for all of you listening or watching us and have continued to follow this podcast, thank you again for joining us. My name's Jaime Gomez again, Service Area 7 Administration, saying goodbye or till next time. Oh, don't forget to visit our website. Go to the LA County DMH website and do a search for Service Area 7. You'll find V.P.A.N, you'll find the Service Area website, and then definitely visit the website for the VA. Those are all great resources that we know that our community can definitely use up. But again, thank you so much. Anne and Angel, thank you for taking the time to being here. We really appreciate it. And again, this is Service Area 7 saying goodbye, everyone.